Who is the most important person when it comes down to safety? Today I decided to go for a walk down the lake and I noticed someone lying on the ground and it doesn't look like he's having an afternoon nap. So what are the things that I need to consider before helping this patient out? I need to remember that my personal safety is the most important thing, and the last thing that I want is to be a casualty myself. So the considerations that I need to take is my environment. Are there any tripping hazards? Are there any rocks, any holes? Is the patient drug affected? Would there be any syringes around? If the patient for some reason is having an afternoon nap, could the patient be aggressive when he wakes up? What is the distance that I need to keep? These are the things that I need to consider before approaching for my own safety. What are the things that you need to consider in your environments? It could be crowds. It could be aggressive people. It could be electricity, electric cables. It could be aggressive family members. Many things that you need to consider before helping someone else. Are you making sure that your personal safety comes first? Thank you for listening and stay safe. How can I determine if the patient is responsive or not? I've checked for my dangers and I'm pretty satisfied that it's safe to help our mate over here. So I need to see if our patient will respond to my verbal commands, to my pain stimuli, or none of them. So first things first is my positioning. I personally like to work from behind the patient's head. That way, if the patient was to become aggressive and attack me, he will have limited range of motion. He can't see clearly what's behind him, and I can escape. So I'll start off by asking a couple of questions. Hi mate, how you going? Can you hear me? What's your name? No response. So then I'll proceed to my pain stimuli. I can go for a sternal rub, like this, with a bit of pressure at the center of the chest. I can even go for a trap squeeze. At this point in time, if I get a response, I'll place the patient in the recovery position, make the patient as comfortable as possible, treat any injuries, and call 000 if required. If there is no response, then I'll be sending for help, which I'll be covering in the next video. Thank you for listening and stay safe. So we've determined that our patient is not responsive. What's next? It's time to call for help. It's time to call 000. The 000 operator will dispatch paramedics or firefighters experienced in advanced life support. Some of the questions the operator will ask you include your location. Make sure you know exactly where you are so services can arrive quickly. The operator will also ask questions like, is the patient conscious and breathing? The patient's gender, approximate age, and many other questions that will assist services on arrival. Make sure that you speak clearly and only give relevant information. Now, if you can delegate the task of calling 000 to a bystander, do so. Or put the phone on loudspeaker so you can proceed with your primary survey. The next part of the primary survey is airways, which I'll be covering in the next video. Now, I can appreciate that a lot of this information is common knowledge and common sense. However, they do serve as good reminders, as a lot of these little things do get forgotten when under stress. Thank you for listening and stay safe. G'day guys, I hope you're all keeping safe and well during these difficult times. This is a continuation of the basic life support series which I started a couple months ago. Feel free to watch those videos on my YouTube channel. Now, I was walking in the park today and I noticed this patient lying on the ground. I've checked for my dangers, I've checked for a response and there isn't, and I've also sent for help. So now I must check for airways. It's very important to check for airways to make sure that there's no obstruction to breathing. Checking airways takes precedence over any other injury. So how do I do this? I'll start off with the head tilt and chin lift. When doing the head tilt and chin lift, this ensures that the tongue doesn't obstruct the airways. Make sure you're not using excessive force when doing this. While in this position, I'll also check for the mouth to make sure that there's no contents in there, such as food or vomit. If so, I can place the patient in a recovery position and allow gravity to empty those contents out. Or I can sweep out the contents with my fingers. Once the airway is clear, I can put the patient in the supine position and then start to check for breathing, which I'll be covering in the next video. G'day everyone. So we've determined that our patient is not responsive. We've sent for help and we've also checked for airways. So now we must check for breathing. It's very important to check for breathing to see if the breathing is regular or if it's abnormal or absent. And then I can ascertain whether the patient needs CPR or not. So how do we check for breathing? We follow 3 easy steps: look, listen and feel. I want to look for the rise and fall of the patient's chest. I want to listen for air movements coming out of the mouth and nose. And I want to feel for air movements coming from the mouth and nose towards my cheeks. I want to do that for about 10 seconds. If the patient is breathing, then I'll place him or her in a recovery position and wait for help to arrive. If the patient is not breathing, I will leave the patient in a supine position and begin CPR, which I'll be covering in the next video. G'day everyone. So last time I checked for my patient's breathing and unfortunately it wasn't there. So it's time to start cardiopulmonary resuscitation, also known as CPR. CPR is the process where we assist oxygen to go to the lungs so it can then go to the brain and other organs, keeping the patient alive. So to start off, you want to kneel next to the patient's torso and remove any clothing. Start by putting the heel of one hand on the patient's lower sternum. Place the other hand on top and lock the fingers. Now perform 30 compressions at the rate of 100 to 120 compressions per minute. That's about 2 compressions per second. Make sure that you go about 5 centimeters deep and allow for full recoil. Keep in mind that rib fractures are very common during CPR. However, this is an acceptable consequence, as the alternative is death. Once you've done 30 compressions, now it's time to give 2 rescue breaths, if you're willing to give them. Start by tilting the head back, lifting the chin and blocking the nose. Then place your mouth on the patient's mouth and give 2 rescue breaths, observing the rise and fall of the patient's chest. If you can't see a rise and fall in the patient's chest, this could be because there's an airway obstruction. It can also be because you haven't blown enough air into the lungs, or there isn't a good enough seal around the mouth and nose. Keep doing CPR until the patient becomes responsive, the patient starts breathing, or when ambulance arrive and ask you to step aside so they can step in. Now keep in mind that CPR is very exhausting, so utilise any bystanders around you at the recommended interval of 2 minutes. Now in conjunction with CPR, we also use defibrillation, which I'll be covering in the next video. G'day everyone. So as discussed in the last video, our patient is unconscious and not breathing. After immediately commencing CPR, we also need to defibrillate our patient. Most people go into a cardiac arrest when the heart goes into a fast, abnormal and chaotic rhythm. This uncoordinated contraction of the heart causes a deprivation of an adequate blood flow to the rest of the body and vital organs unoxygenated, leading to death. What defibrillation does is that it terminates this uncoordinated and chaotic rhythm. The earlier this process commences, the earlier we can get a normal blood flow to the rest of the body, the greater the chances of survival. Ultimately, for every second or minute defibrillation is delayed, the less chances there are of survival. This is why it's so important to familiarise yourself with the AEDs in your workplaces and in public spaces, in case you need to use one. It is also important to get trained on how to use this device. However, this isn't limited to just trained personnel, and the voice prompts will make it so easy to use this device. So make sure that you follow the voice prompts carefully on pad placement, and also when to shock and when to stand clear and when to commence CPR. Also, if CPR is already in progress, don't stop CPR, work around the person. And if you can't find a defibrillator, that's okay. Continue compressions and call 000. Thank you for listening and stay safe.